Okay, so now we have 7 high priority items that either need to be checked or done in the first 30 seconds of patient care. So, number 1, scene safety. Look for dangers, look for weapons, look for wires down if it's a motor vehicle crash, etc. Second, look for clues. We call that the scene survey. Look to see if there are open pill bottles, if there's a needle, if there's a ladder knocked over, if there's furniture turned upside down that would indicate what could have possibly happened. Third, we're going to look at the patient's skin color. So we're looking for whether the patient's skin color looks normal for the patient. Are they pale? Are they red flushed? Are they yellow, jaundiced? Are they cyanotic, blue? Fourth, we're going to look at level of consciousness. If their eyes are open and tracking you as you walk into the room, they're alert. If they only open their eyes when you speak to them, they earn a V for verbal. If they don't open their eyes when you speak to them and you do a sternal rub and they respond to that, they respond to pain. Lastly, if they don't respond to pain, they are unresponsive or unconscious. Fifth, we need to worry about circulation. So we're going to check for a central pulse, a carotid pulse. If there is no carotid pulse, we need to call 911 right away to get the AED onto the patient and to get the patient defibrillated if necessary. In addition, we need to get on the chest and do good chest compressions right away. If the patient does have a pulse, then we can move on to the second part of circulation, which is controlling massive bleeding. And we control massive bleeding by either putting on direct pressure, elevation, pressure point, trying to put pressure on an artery to reduce blood flow, or a tourniquet use. Tourniquets do not need to be fancy. A belt can do the job. Once we have taken care of circulation, we're on to airway. If the patient is speaking to you, their airway is probably good. If the patient is unconscious, we have no way to guarantee that they have an airway. If you can't guarantee an airway, you have to give them one. So, let's go with an oral airway. We insert the oral airway. Good, now we have an airway. Oh, our patient's vomiting, gagging. Pull the oral airway out immediately. Tilt the head. And suction. Good. When the patient's done vomiting, head back to neutral position. Now, we don't want to reinsert the oral airway, so let's insert a nasal airway. Mannequin doesn't have nares, so we'll pretend. That's number 6 on our list. We've taken care of airway. Next, look, listen, and feel for breathing. You're looking for a chest rise, you're feeling for it on your cheek, and you're listening for it. If the patient's breathing, we're done the first 30 seconds, move on. If the patient's not breathing, we have to breathe for them. You can either do mouth to mouth to mask, both of which will give the patient 16% oxygen, because that's what we exhale, or use a bag valve mask, BVM. If we start off on room air, which we normally do, the patient's getting 21% room air oxygen. Once we hook the tubing up to an oxygen source and crank it up, the patient is now getting 100% oxygen. Either one of these 3 methods, we ventilate, so we breathe for the patient just until the chest rises, then stop. That completes our first 30 seconds of patient care.